Hello everyone, my name is Mina and I will be presenting our study with the title of Is Midurethral Sling the gold standard for stress urinary incontinence? There is no conflict of interest to be declared. Stress urinary incontinence is a common distressing health issue with a significant negative impact on quality of life, and different surgical procedures have been developed for treatment of those women. And one of these surgical procedures are the midurethral slings, which have largely been regarded as the gold standard in treatment of stress urinary incontinence. But recently, the safety and use of midurethral slings has called into question following concerns about the mesh implants. Which brings us to the aim of our study, to evaluate the effectiveness of tension-free vaginal tape obturator and transobturator tape treatment, and to assess the prevalence of intra and postoperative complications. Our study was retrospective observational analysis for 6 years, covering all synthetic midurethral sling operations for stress incontinence in our facility. Data was collected from the medical records of total 196 women who underwent tension-free vaginal tape obturator and transobturator tape treatment, and the type of information collected as following: whether the type of incontinence had been confirmed by urodynamics, whether conservative treatment had been tried prior to the surgery, and the information provided to the patient prior to obtaining the consent, any complication during or post-operatively, and the patient cure rate. The preoperative results showed that 74 out of 196 patients have tried conservative management before undergoing surgery, although all patients have been counseled and referred to the physiotherapy prior to the surgery. 70 out of 196 patients performed urodynamics before undergoing surgery, and all the patients were counseled and consented for the surgery. Intraoperatively, there were no recorded adverse events, which is comparable to the reported complications in the large published series. 2 of our patients in the immediate post-operative period had urinary retention and were catheterized for 24 hours, and the condition resolved. 4 patients had lower limb paresthesia, and it resolved by physiotherapy. 9 of the patients, which is 5%, had failed to adhere to follow-up, leaving a total of 187 patients that were totally cured of stress incontinence. Total of 22 out of the 187 patients had overactive bladder. 20 of them were pre-existing, while 2 of them were de novo overactive bladder. And 3 patients had voiding dysfunction, out of which 1 patient had a tape division. And there were no recorded cases of mesh erosion or urinary tract infection. Comparing our results to the international benchmark success rate and the literature reported complications rates, our analysis has proven positive outcome and in line with the international recommendations. Our data presents that midurethral slings is highly effective procedure with high safety profile, satisfactory outcome, and significant improvement in patients' quality of life. Tension-free vaginal tape obturator and transobturator tapes have been a major advance for surgical treatment in women with stress urinary incontinence and still remains the gold standard in their treatment. However, the FDA has reclassified the mesh as a high-risk device. Thank you, everyone.